All right, we are back with Nurse Christine Brannick, the Oncology Outreach Manager with Cone Health, and she's talking about everything we need to know about colonoscopies and colon cancer. So just how concerning is it that people have put off colonoscopies because of COVID and things like that?
It is very concerning because, as I mentioned earlier, that if we find a colorectal cancer later, it does decrease the options for treatment and can decrease the chance of survival. So it's very important not to let COVID delay you get your screenings.
All right, so what age, let's talk about this. What age should we start getting our colonoscopy, and then how often do you get them?
So we recommended age 45. Now, if you have some of those risk factors that we mentioned earlier, then obviously it would be sooner. A lot of times we look at too, if you've had a family history, usually around 10 years prior to that youngest family member being diagnosed. And again, if you have any of those other, then you would need to talk to your provider about the best time for you.
All right, let's talk about the procedure itself, because I think when people hear colonoscopy, they're like, oh my goodness, what is that? So let's kind of talk about what someone should expect with a colonoscopy, and what will that procedure day kind of be like?
So it all starts, usually your doctor's going to give you what they call a bowel prep regimen. So a few days before, they're going to usually recommend you eat more of a low fiber diet during that time. Then usually around the day before, they'll tell you to start drinking, basically eating clear liquids, which would be kinds of foods like broth, maybe Jello or popsicles. But if you do eat Jello and popsicles, not the red ones. And then usually the night before, or depending on what time of the day it is, they'll tell you a certain period of time that you'll need to have nothing to eat or drink before that procedure. You will start drinking with that bowel prep regimen usually around the day before to make sure your bowel is clean. And the more clean that your bowel is, the easier it will be for the doctor to see your colon. And if they were to find any polyps, then they will be able to remove those. Usually the colon cancer does typically start as a polyp, so if we can get them out before they become cancer, then again, usually that's all that needs to be done, and we just watch that.
All right, so this is an outpatient procedure, so you're
Yes.
going to do the preparation beforehand, you go in that day, and then you're home that night.
Yes, usually you go home right after the procedure, and usually pretty much after the procedure, you can pretty much eat and drink as you feel comfortable. Sometimes you may feel a little gassy afterwards, but usually you don't remember anything. They're going to give you a medication, and if you are awake, you won't remember anything about it.
Right, you need someone to drop you off, and you need someone to pick you up and take you home. That is for sure. All right.
Yes, you do.
Any recommendations to help calm our nerves before we do this kind of procedure?
Basically, my biggest recommendation is follow the diet instructions your doctor gives you. So as they tell you to go to clear liquids, when they tell you not to eat anything or eat or drink anything, make sure you follow those recommendations, and it will make it a much smoother process.
Okay, and you said no red Jello or red things to drink, that kind of thing.
Yes, correct.
That red dye is not good in your system when it comes to this stuff. All right, so what steps can people take to reduce their risk for colon cancer?
The biggest thing is to eat a healthy diet, which is low in fat and high in fiber. Stop smoking, limit your alcohol intake, obviously exercise. Screenings are so important because if we can get polyps out before they turn into anything. Also, know your family history. If you have a family history, talking to your provider about the best times to get screened. As I mentioned earlier, there is genetic testing if you are somebody that has that strong family history.
Mm-hmm. And this is one of those times, because some people have been keeping it off, right, for COVID and stuff like that. But sometimes now when you call the doctor's office, they're scheduled months and months out. So we don't want people to wait to make the call.
Well, and it's important to know what's normal for you. So if you notice any changes, make sure you report that. And let your provider know, because that way they can get you in when you need to be screened.
Great. Thank you so much for your time and your expertise. We so appreciate that. If you missed any of this, you can find the information on our website. That's WFMYnews2.com.